Joining us now is Dr. Chad Hammett of the Texas Health Spring Network. He's here to talk about congestive heart failure. Thank you very much, Doctor, for waking up with us this morning. We appreciate you being here. Now, what is exactly congestive heart failure? Explain that.
Well, along with heart disease, there's several other different things that takes part as far as heart disease, as far as coronary artery disease, CHF, or congestive heart failure. Congestive heart failure is pretty much where the function of the heart it just starts decreasing as far as, I think of it as a water pump. After years of being there for years and years, eventually that water pump is going to diminish, and that's exactly what happens with the heart. The functionality of the heart starts decreasing, and it leads to other symptoms. So.
And what are the risk factors that lead to congestive heart failure, and how do we prevent those from getting to that point?
Well, it's kind of like when you go to Sunday school, you always get, feel guilty about a preacher preaching to you. You go to a doctor's office, the main things we focus on is, focusing on your hypertension, focusing on not smoking, with today's, percentage of 60% of the adult population being overweight, that is a big part of all this.
No stress. Keep the stress out of our lives.
Don't eat all the fatty foods. High blood pressure control. High cholesterol, high triglycerides.
That's hard for us in Texas when we're used to those types of
especially
foods.
Southeast Texas too.
Yes, yes. What are the symptoms that people that might need to go see a physician if they're is it just chest pains or?
Well, there's several main symptoms that you should focus on. Mainly, when you start seeing bilateral lower extremity swelling in your legs, you can almost put your finger in there and see your thumbprint. That's pretty significant of swelling. Also, you get shortness of breath with exertion, kind of like what you do with having angina. But you'll start getting more tired, fatigued, just walking up a flight of stairs will make you short of breath. And that's pretty much because you got a bunch of fluid sitting in your lungs.
So how do you treat congestive heart failure?
Well, there's, it depends on what stages of congestive heart failure there are. This morning I would really bore y'all if I tried to do that. But mainly, you want to give a fluid pill such as Lasix, their furosemide, which they give horses.
The Lasix, they gave that to race horses.
That gets rid of the fluid. Also, we use what we call ACE inhibitors. Much of y'all out there might be on lisinopril, acapryl. Much of there's a diffuse or diverse kinds of ACE inhibitors. And once the heart gets to the point where it needs more functionality as far as helping it contract and decreasing the heart rate, which is the big thing with heart failure, is making sure the heart rate's normalized, is like metoprolol, or to give you any common names, I guess this metoprolol is a generic name for what we call a beta blocker.
Now, is this really who's at risk? Can this be just about anyone? Should teenagers and young adults be checked?
Well, it mostly happens in our elderly population. I guess, you'll start seeing signs and symptoms after the age of 60. But, I had a patient in my training in Fort Worth that was 40 years old that just had uncontrolled high blood pressure. And he was looking for a heart transplant at 40 years old. And it can also be due just to a viral infection that can affect the heart. Those are very rare, but there is, for it to occur in young people, it's very rare, but there is some people dealing right now, they're in their mid-30s, early 40s that are dealing with a rare type of congestive heart failure.
And what kind of tests do you do to check the heart? Do you do stress tests in your office?
Well, mainly, as far as, when you go in and have angina, we all have stress tests to make sure we don't have blockage around the heart. But the main way to find out if you have congestive heart failure is to do what they call a cardiac echo. And that's where they do an ultrasound on the external part of your heart. It's really non-invasive. And also, if it leads to that, and they will do what they call a stress test to see if there is any blockage around your heart that you didn't know you had that could be leading to you to have congestive heart failure. So
it's really important to watch what you eat, exercise, and just really take care of yourself.
And you know what? And that's really all we really have to do, but that says a lot because it takes me every day just to remember how I need to live. So.
Yeah, I think we all have that too. And you can also call 1-800-846-2098 for more information. And this is Texas Health Springs. You can also go to their website, which is www.healthspring.com. Doctor, thank you so much for spending some time with us this morning. We really appreciate the fact that you came in. Have a wonderful day.
I will. Thank you.